biological life support for human habitation on Mars. In just over a decade, NASA plans to send the first humans to Mars. So it's actually not that far away. And when they do so, if they use current technology, they're going to have to bring all of their food and pharmaceuticals with them. For the 210-day journey to the Red Planet, the 500-day stay on the planet, and then the 210-day journey back. So there are some issues with that, unfortunately. I'm sure you can think of some of them, but for the pharmaceuticals, 75% of them will have degraded by the end of this duration of the solid formulations. And if you forgot something like an aspirin, you're going to have to deal with 130 days of headaches before you can get an emergency resupply of your aspirin. But if it's worse than aspirin, or if it's worse than a headache, then you've got a serious consideration and an emergency on your hand. As far as food goes, it's really a mass and volume issue. So, for example, 60% of the total mass of a recent ISS resupply was purely based on food. And if you do some back-of-the-envelope calculations, the amount of food you need to bring is 10,000 kilograms for that 800-day journey for a crew of 6, which is what they're planning. What makes this even more preposterous and difficult to achieve is that for each unit of mass here, you need 99 additional units of mass with your rocket infrastructure and fuel, and so you can see this starts to snowball out of control here. So what if instead we considered a different situation? What if we were able to make use of some of the resources that were on Mars to produce the food and pharmaceuticals that we need? So, as everyone's probably aware, plants have been studied for a long time now as a source of food in outer space exploration. They can use photosynthesis, they can close the waste streams with humans because they can take in the CO2, produce oxygen, and they produce food while they're doing all that good stuff. But our lab group also argues that they can be a great source of pharmaceutical production. So just for time frame here, because we're talking about producing it on a planet, between 20 and 130 days, you can produce the crop to maturity in which you could harvest it for food. And now if you're using this for pharmaceutical production, that's going to take you up to an additional 20 days to do the manipulations required to have that plant produce your pharmaceuticals and accumulate to the level that you want and harvest it. And so, like I said, producing food from plants is well established and well studied in NASA. However, producing pharmaceuticals is not. And so I'll leave the bulk of why you would want to produce pharmaceuticals in plants to Mary, a future STEM Talk presenter, and also a lab member in the McNulty lab. But needless to say, it's not as simple as you have your plant and it all of a sudden just makes these fully formulated pills and bottles for you that you can just take. There's some processing involved, in fact quite a bit of it, and it looks a little bit less like this and a little bit more like this. And now, this isn't meant to be something that I'm going to go through line item by line item, but it's meant to show you that there's a lot of complex equipment involved as well as a lot of complex reagents and inputs required at each one of those steps. So, if you're thinking like I was, you're thinking, okay, so you're proposing to produce food and pharmaceuticals on Mars to save yourself all of this food and pharmaceuticals you need to bring with you. But if you're needing to bring all of this equipment and chemical reagents with you, what are you really saving here? You're changing your food for now equipment. And so that's what I've been thinking about. And so how do you reduce what this equipment is? How do you reduce all the processing that's required? And so what I'm here to talk to you about is a plant virus-based immunosorbent nanoparticle as a solution to reduce the equipment requirements. So if we go, this is a difficult angle. So if we go, so the first two layers, most of you are probably familiar with. You've got your viral RNA and coat protein, and that forms your wild-type plant virus. What we're doing is we are genetically fusing a Fc affinity protein to the outside of that coat protein. And by doing so, we create a particle that is capable of purifying pharmaceuticals. So you can see you've got a coat protein domain and you've got an Fc affinity protein domain. This Fc affinity protein domain will be able to bind and elute antibodies and Fc fusion proteins, which make up about 50% of the global pharmaceutical sales or biopharmaceutical sales. So needless to say, this covers quite a range of pharmaceuticals that you might need on an emergency. And you can also see that there's a linker domain here in between the two, and that's meant to space out these two large domains to help with the self-assembly of these virus particles. So, and like I said, here I'm illustrating that the antibody can be captured on these virus particles. And so you can imagine that these are plant viruses that can infect plants. They're non-pathogenic to mammalians. And when you infect them with the plant, it's very simple to synthesize. You just infect your plant with this plant virus, and the virus does all the work of replicating and synthesizing, and you don't really need any reagents to make it happen with very high fidelity compared to maybe chemical techniques. So now that I've explained what it is, how would you go about using it? And so what we've done so far is a pretty simple scheme for purifying this virus and using it. So you've infected your plant with your plant virus. It accumulates in the leaf tissue. You can then take that leaf tissue, blend it up, pass it through a cheesecloth strainer, perform a chloroform and PEG precipitation to clean that virus stream up. And now you've got a clean virus in solution. Now at this point, you're going to have one plant that you've infected with your plant virus, that's your purification device, and you've got another plant that you've infected to produce your pharmaceutical, your antibody. So at this point, in the second line here, is where you'd actually merge those two streams. So you introduce your antibody stream to the virus. Because of the affinity, they will complex together, and that complex is much larger than any other soluble impurity in the stream. So you can take advantage of that property, that size property, and actually spin it down into a pellet. At that point, you can resuspend the pellet in a low pH solution. At this low pH solution, the affinity with the virus and the antibody lowers such that the antibody now separates. And because this plant virus is much larger than the antibody, you can do that same centrifugation again and spin down the now separated virus, and now you have your isolated antibody and your virus. And of course you need to neutralize the pH here. And so with this technique, we're able to show that we were able to successfully produce an immunosorbent plant virus capable of doing exactly this. So I'm just going to go through this quickly, but this is just a proof of concept to illustrate that, yes, we did it. I'm not just talking nonsense to you. We have our crude virus here. The next lane over is the purified virus that's starting material. This middle band here represents the what you'll find the coat protein of the virus. In the next lane over, that is actually the virus and antibody complex that precipitated down. So you can see that there's quite a bit of antibody per virus here. In fact, it looks much higher than 1-to-1 ratio here. And the next lane over is the antibody that we were not able to capture. But as you can tell, I just overloaded the antibody in this case. And the last two streams are the recovery streams of the virus and the antibody. So you can see that there needs to be some work done to improve this recovery. But we're looking at 20 to 30% recovery of the antibody based on other tests, and only about 10% recovery of the functional virus, which is something worth investigating. But now I want to take a step back and say, okay, we've done this preliminary work. How feasible is this? So based on how much we're able to purify of this virus, it's about 300 milligrams per kilogram of leaf tissue. If you took just 100 grams of leaf tissue, you could generate enough virus to purify between 33 and 66 milligrams of antibody. Now, what does that really mean? For perspective, two space-relevant conditions would you be concerned about would be bone degeneration and cancer from increased radiation exposure. These two antibodies that treat that, you can see the dosage is well beneath what you're able of producing here. And so I'd say we're looking pretty good to move forward with this technology. And with that, I want to talk about what are some of the future works. So there are some future works underway in each one of these three stages, but I don't have time to go into them. So the first stage is further characterizing and designing these viruses. If I find that there's some limitation that I think can be improved just by making, or limitation that can be overcome by improving the virus in some way, I'm going to be considering that, as well as characterizing some of the performance better. Then I'm going to be looking at immobilizing these viruses for advanced processing strategies. So most people are familiar with things like chromatography, and there's a reason why we don't run things in batch mode, right? And so I'm a chemical engineer, and that really interests me. And in the third category, we're looking at, getting NASA on board to make sure that they believe us that this can be done on Mars. So reducing those things like chloroform and polyethylene glycol. With that, I'm going to end off with a quick demonstration of some work we're starting on that third stage to reduce these chemicals. So this here is a hand-powered centrifuge. So, as silly as it sounds, this is something that we've 3D printed, prototyped. You can take Eppendorf tubes, slot them here into this disc, and just using a simple rotation, you can actually get up to 6,000 RPM so far with this current design. And we've been able to precipitate plant tissue with this. And so there's a lot of promise that we're looking for these limited resource environments and thinking that there's a lot that hasn't been explored. And with that, I'd like to thank everybody who's helped me on this journey so far. It's been a lot of people. I make a lot of stupid mistakes. And so I'd also like to thank the funding I've had. So through the Center of Utilization of Biological Engineering in Space, part of that center, they've given me a lot of help. I'd like to thank my NASA Space Technology Research Fellowship and the VIP UC Davis, which is a program that helped me with this hand-powered centrifuge. With that, I'd like to take any questions. Thanks.